Back on MorningLine. Thanks for joining us, talking Mental Health Awareness Month specifics with the layers that the state of Tennessee is doing dealing with mental health issue, with the treatments that are out there, along with the opioid addiction, all of that with our great panel of guests. Marie Williams is the Commissioner, Department of Mental Health and Substance Abuse Services, and her two colleagues who work with her, Bo Turner and Matt Yancey. Thanks, guys, for coming on. Thank you, ma'am, for joining us.
Thank you.
Let's see, we've got a few more phone calls, if that's all right. Let's grab a few of those, and we'll go to Brian. Hi, Brian. Good morning.
Good morning, guys. How y'all doing this morning?
Good morning, Brian.
Good morning. I was going to ask you, I remember back when I was young, they used to do lobotomies on people. Do they still use that method of treatment on patients, or is it not? And I'll sit back and listen.
All right. Lobotomies, that's long gone, is it not? As far as you know, it's going back to, one flew over the cuckoo's nest, I mean.
It is not a standard intervention, no.
Very, very, there are alternatives that are far better than going in and slicing someone's brain in half.
Yeah.
So, yeah, they don't do that anymore, at least not that I know of.
We don't.
You don't.
That's right.
Anyone who does, except in maybe some very extreme cases. Let's go to next, we've got Mike. Mike, good morning.
Hey, good morning, Nick. How y'all doing?
Hey, Mike, good. What's on your mind?
I just want to compliment you and WTBF for having your guest on and bringing this discussion to the forefront, and much of it, whether it's the opioid crisis or alcoholism and substance abuse, or we see, some of the, sadly, some of the school shootings. All this, in my opinion, ties into mental health. And currently, I've got a mother at Trust Point right now that's had a few issues, just getting old, and they've been taking good care of her. But I think when it comes to the drug problem, if we're all honest, most people have seen this in their family one way or another when it comes to addiction and alcoholism. But I just wanted to call you and just say thank you so much for taking this issue on. And I want to thank the Commissioner for talking about this. I've been on with your show with John DeBerry and the late Assistant Commissioner Bragg a few years back, and I just want to say thank you for what y'all are doing.
Oh, thank you. I appreciate it, Mike. As Representative Mike Sparks, and he obviously has been on this show and means a lot to him. I mean, the legislature's obviously behind all this, right?
They absolutely are. And again, we can't say enough of thanking them, as well as our governor and the leadership, to give us even more funds this year to do more to address people that are dealing with an opioid addiction. It is going to go a long way to serve those Tennesseans that are struggling. We know in our state right now, based on prevalence data, that about 82,000 Tennesseans are struggling with this addiction.
82,000 right now?
Right now. That's what the prevalence data shows.
And how many of them do you think have a mental illness?
And I would not want to guess on that. I'm sorry, I don't want to make a guess on that. And then we know about 300 and something thousand, of which that 82,000 is a part of, are abusing opioids. So the fact that our legislature and our governor said we're going to continue to give funds to treat these addictions is vital, because this is not something, and those that are listening today will tell you, if you're addicted to an opioid, waking up and saying, I guess I'll stop, doesn't really work. Detox is extremely important for that individual, because they go through so many physical and psychological issues as they come off of that medication. And so we are grateful in our department that we have funds to expand access to detox services and medically assisted treatment and other types of recovery services.
Yeah, in terms of getting them to seek the treatment, I mean, we're talking about people with a stigma with mental health issues, maybe having some concerns about coming forward. Now, as far as the addicts themselves, I don't know if it's the family members and the community services that get them to come forward. I mean, that's the trick sometimes too. And especially now we see, some of these drugs being tainted, and we're getting all these horrible overdoses right now.
Yes.
Fentanyl.
One thing, and I know Matt's going to want to say a lot more about this. Couple things. We worked with THA, and we determined that there were 40,000 Tennesseans, 40,000 unduplicated Tennesseans that came to emergency departments that were dealing with an opioid overdose or abuse issue. And Matt's team and their leadership with Assistant Commissioner Taryn Sloss have created a new program to target that. And Matt, would you tell us about that?
Yeah, I mean, I think one of the most important adjuncts to treatment from a clinical perspective is peer support. So one of the things that we're doing specific to the opioid crisis here in Tennessee is taking people with lived experience. We call them certified peer recovery specialists. They are actually being embedded into targeted emergency rooms across the state.
These are former addicts?
These are people with lived experience.
Wait, what does that mean?
People who have a previous substance use disorder, they may have a mental illness, they're in recovery.
Okay.
And these individuals are actually working with people when they present in the emergency department prior to discharge to make sure that they have access to treatment. They're that conduit that hasn't always been there.
Because they've been through it, right? So they kind of know what these people want. That makes that's just so obvious. Why has that not always been done? You know, I'm sorry, that's obvious. That's a no-brainer. That's a great idea.
Yeah.
All right, so.
Well, and I think people with serious mental illness, people with substance use disorder, we've realized a long time ago that you have to go beyond the kind of biomedical approach. These folks need peer support, they need family support, they need housing, they need supported employment, supported education. You really have to provide a comprehensive array of services to get people on the right track.
You know, and you talk about the money that's been given to you by the legislature. They increased that. I'm just curious, in a lot of these cases then, whether it's an opioid addiction or a mental illness and they're getting one of those beds, how is that being paid for? I suppose if someone has a means to pay, you know, it's not everyone can afford to send someone to the Betty Ford Clinic. I mean, so how is it paid for sometimes, especially when they're indigent, I suppose?
Yeah, one of the things that we spoke with the governor about in our work group was the fact that if you take that $82,000 and you divide up what kind of group that is, you saw that about 12,000 of those individuals are indigent. They don't have insurance, they don't have TennCare, and they don't have a means to pay. And so for that population, I am proud to say that we've been serving almost 6,000 of those people, and we're hoping that with these new funds we could get to about 9,000 individuals out of these new funds we would pay. Our department would pay those contracted providers that are across the state and pay for that person's care.
On the others that do have some means and aren't indigent, is it a sliding scale perhaps, or is it they have to have a means to pay? I don't know if insurance covers it sometimes. What?
The other thing I'm excited to say is that we put together the first ever in the state public-private partnership with those for-profit treatment centers. We've never sat down with those individuals, and so we've just had 2 meetings with them to try to find out what they could do, whether it's sliding fee for people. They do that right now. There are a lot of for-profits that will do sliding fee scale. They also take insurance, private insurance, and in some cases they take TennCare. So we're wanting to do what we can do because we know that right now 3 Tennesseans are dying every day because of this opioid issue. We know that as we've clamped down, and this is something the Tennessee Bureau of Investigation has worked really hard with us on, is looking at those areas in our state where people have switched over to a street drug that may be laced with fentanyl, so that you're going to see more overdoses, not because of the original opioid, but because of a switch to heroin or a drug that's laced with fentanyl. And we are seeing increases in our state of those type deaths.
Let's take a phone call from Marie. Marie, good morning.
Good morning.
Hi, Marie.
Yes, I'm retired now, but I used to do counseling and such, and I had quite a few neighbors living here in Tennessee that had mental issues, and I would help them out. I would go with them to their psychiatrist and stuff. And one of the things that I have found that was, my opinion, very, very bad, because when I went to college, we were trained to counsel the person, not just sit there and ask 1 or 2 questions, and then the rest of the hour they're writing out prescriptions instead of counseling the people.
You don't think that's being done enough, is what you're saying?
Exactly. They're not counseling their clients. And what it is, too, is that I've done a lot of research on this, whereas the doctors today, they get kickbacks from the pharmaceutical companies.
Yeah. Well, listen, I think she's right. We're a pill-popping society that wants an easy, quick cure.
Yeah.
And the idea of bringing, which takes more time, therapy, psychotherapy, or talking and counseling, like she says, it's a biggie, right? I mean,
it absolutely is. And Marie, one of the things that we spoke about earlier was the fact that with our new regulations around treatment with MAT, we are requiring providers to have wraparound counseling services.
That's part of the deal.
That's part of the deal.
All right.
And I think
that's great.
I think that's also important to everything we do, to have that continuity of care and connectivity at the regional mental health institutes, obviously, which is the highest level of care. There is active involvement with community-based programs. We've got peer support people in the facilities to make sure that after you've been to the regional mental health institute, it's just not kind of, hey, have a good life, see you later, that there's that connectivity, so there's smooth transition and support at all steps of the treatment continuum.
Yeah.
Do you guys get feedback from law enforcement? I know you've said you've met with, Davidson County Sheriff Darren Hall, who's a huge proponent of what you guys are talking about, and whether or not some of what we're doing is seeing a little bit of a reduction in the revolving door for some of these individuals that have mental illness, go in, serve their time, get out because they don't get treatment, and then go back.
Matt, I would love for Matt to talk about our pre-arrest diversion programs. Okay. Our governor gave us $15 million a year ago. The legislature approved it, and he can tell you what's really happening to impact what's happening in the local law enforcement areas.
Yeah, I mean, I think there's been a paradigm shift within our law enforcement communities that people with mental illness, people with addiction, they don't need a jail bed, they need a treatment bed. And as the commissioner mentioned, we were fortunate to receive a $15 million appropriation to build infrastructure across the state for pre-arrest diversion. So for individuals that commit low-level offenses in the community, whether that be panhandling, loitering, what have you, in lieu of them being taken to jail, arrested, we're actually sending them to centers that can provide treatment.
So they're picked up, and in the past they might have been taken in and booked on a misdemeanor even, or whatever it is.
That's
now,
right.
the law enforcement officer makes the call when he sees them there, if he can tell there's a distress, and then they take them someplace else.
And here in Nashville, they're taking them to the mental health cooperative. I guess it was maybe a few months ago, there was a big groundbreaking there at the cooperative. They're building a state-of-the-art center that's going to really work with those individuals that, on the front end, interface with law enforcement, but we're diverting them from jail, we're getting them into treatment.
Yeah, see, I mean, that's just such a good idea because, I mean, it's going to help them better.
Yeah.
It's going to save taxpayer money because it costs a lot to incarcerate people.
It absolutely does, and what's really great about this program is we were able to get each local community from Memphis to Knoxville, each local community put in 25% match to the dollars that we gave them, and I think that's a great use of taxpayers' money. And they're continuing the programs this second year, and we're going to see what the outcomes are of that.
And I think that that's also reflected, the effectiveness is also reflected in the very low readmission rates we have to the regional mental health institutes, less than 8% over a 30-day period. So it's not a revolving door. There really are things that are impacting that.
Yeah, and that's the difference. You don't have people coming back to you because you're getting them treatment, whereas they are coming back to the prisons when they don't.
Right.
It's a good example. All right, we'll take a break. We'll be back. Our final segment, more of your calls right after this. Stay with us.